Are you pregnant and currently experiencing some pelvic pain? Well, if so, don't click away, because in today's video we're going to talk all about that pain, exactly what it is, what causes it, and of course ways to relieve your symptoms and relieve some of your pain. Pelvic pain, also known as girdle pain, is very common during pregnancy. It can be caused by a whole bunch of things, one of them being the weight of your baby actually putting pressure on your pelvis. Another one can be your posture, and in more significant or severe cases, it can be something called Symphysis Pubis Dysfunction. Symphysis Pubis Dysfunction, also known as SPD, is described as being a severe pelvic pain that gets worse when you lift one leg at a time, doing things like walking upstairs or even getting dressed. It also is significantly worse when you are switching positions at night, and can also be aggravated by even just walking. This is also described as having a feeling of cracking, shifting, and even the feeling of your hips dislocating. So let's talk about exactly what causes this, and that is my favorite hormone called Relaxin. The reason I say my favorite hormone is because for me, this was very intense. I definitely had SPD and it hurt very badly. So what is this hormone relaxin? Relaxin is a hormone that is released by your ovary and your placenta into your circulation that causes exactly what it sounds like, a relaxation of your muscles, ligaments, and everything in your body. Relaxin is a hormone that is actually very beneficial during pregnancy. It allows for your baby to be able to grow inside of your body. Once you get closer to giving birth, the hormone relaxin helps with allowing your joints to move in your pelvic area so that your baby can pass through, and it also promotes the rupture of your membranes and the opening and softening of your cervix. Now, even though relaxin has a lot of wonderful benefits during pregnancy, sometimes it can do its job a little bit too well, or sometimes your body can overproduce the hormone, causing everything to be a little bit extra relaxed. More specifically in your pelvis, the ligaments that usually keep your pelvic bone aligned can be overstretched, causing everything to be really unstable and of course painful. So how do we treat and relieve the symptoms and pain of SPD, pelvic pain, or girdle pain? First thing to remember is to avoid triggers. So any activity or movement that you're noticing that causes more pain, try to avoid that as much as you possibly can. Other things to avoid are, of course, heavy lifting, pushing or pulling anything heavy. Avoid that as much as you can. When you are getting dressed, make sure that you are sitting down when you're putting on your socks, shoes, pants, anything that usually causes you to lift one leg at a time. Heat or ice can also help with the pain, but make sure that you are not using either one of these for more than 10 minutes at a time. A pelvic support belt can be greatly helpful, as well as pillows when you are laying down or sleeping or sitting down, making sure that you are supporting certain parts of your body, especially in between your knees, and you know that you are pregnant and you are having to sleep on your side, and that can actually cause a lot more pain. So having a pregnancy pillow or any support in between your legs is going to be very, very helpful when it comes to your pelvic pain. The most effective way to relieve some of the symptoms and relieve some of the pain is going to be a physical therapist, or pelvic floor exercises, or prenatal yoga, anything that gets your core and your pelvis engaged. I highly recommend a physical therapist. This is something that helped me so much with my second pregnancy. I did not do it on my first, and I don't know why. I just hadn't heard of it, and I'm so glad that I was actually referred by my doctor to a physical therapist, because it made a world of difference. I do have a video coming up in which I'm going to show you all of the exercises and moves that I learned in physical therapy that can help you with your pelvic pain. It helped me tremendously, so don't forget to subscribe so that you don't miss out on that video. Hit the notification bell so that you're notified. Let me know in the comments down below, how far along are you in your pregnancy? Don't forget to give us a thumbs up. Have a wonderful day and a wonderful rest of your week, and we will see you next time. Bye.